You can't control labor. It's something that it will happen no matter what. It will be powerful, it will be intense, and you can't control it really, but you can control your breathing. And that's all the difference that matters. Sure, you are thinking, clicking on this video, what it is to know about breathing that I don't already know. Why is it really so important for labor? Breathing is the process of moving air in and out our body through respiration, through our breaths. And yes, we do it since the day we are born. Thankfully, we have a wonderful muscle, a diamond-shaped muscle called diaphragm that helps us to do this act of breathing in and out completely involuntarily and completely without us knowing it. Of course, we are aware and conscious of our breaths, but we don't have to control and command this act every second. So through the diaphragm, we introduce in our body air full of oxygen, ready to be used in our body's cells in order to function and to work properly. And then through while we exhale, we put out air full of carbon dioxide that we don't need. However, the diaphragm is also a voluntary muscle, meaning that we can control it. If you think about the muscle in the heart that regulates our frequency or bowels, those are all involuntary muscles that we're never going to be able to control. The dual aspect of the diaphragm muscle being an involuntary muscle and a voluntary one, I don't really think is put there randomly. I think we can use it greatly in our favor for labor if you use it correctly. Breathing in labor is a non-drug comfort measure used to achieve deep relaxation. Deep breathing activates a process in our brain that allows us to reduce the blood pressure, reduce the production of stress hormones, increase the sense of control, increase the production of relaxing hormones, and increase the level of oxygen. All of these activates a mental process in our body, in our brain, that let us feel pain like a less unpleasant feeling. And it's wonderful because it suits you, it balances you, it brings you back to calm. We do it in every moment of our life when we're absolutely stressed. We just take a deep breath and things suddenly calm down. So why don't we learn to use this technique in our advantage to cope with labor? I've seen so many women coming prepared for birth or thinking that they were prepared for birth with a very detailed birth plan and wanting dim lights in labor, low voices, with their own playlist of music to listen to or with aromatherapy, and then lose control as soon as the contractions were becoming more intense. And of course, all these things that I told you are very, very important to make sure that the environment you're laboring in, it's nice and comfortable. But you want to be your best anchor. You want to be your best investment, because when there's gonna be the doctor that enters in the room turning the light on, or the colleague midwife that enters using a loud voice because there is an emergency next room, if you breathe consciously and deeply, then you're never gonna lose the focus. And you don't depend on surrounding and things around you to be relaxed and controlled during your labor. You can't control labor. It's something that it will happen no matter what. It will be powerful, it will be intense, and you can't control it really, but you can control your breathing. And that's all the difference that matters. At the end of the pregnancy, your baby will drop in your birth canal, so we will actually be more free to do these deep breaths. So if you're practicing it now and you don't feel you're able to empty your lungs completely because you have a big uterus in your belly, that's normal. Just once you get the mechanism and the idea of it, then you'll be fine once you're in labor and your baby drops in your birth canal. So today I'm gonna tell you 3 breaths that I teach to women in labor. There are a mix of different breaths from hypnobirthing, Lamaze, and all different methods of birthing and preparing for labor. It's kind of a mix that I personally use and I find to be very effective. You can use them all, you can mix them, you can change them slightly once you get the concept of each breath and in which phase of labor you can use it in your advantage. So the first breath I'm going to tell you today, it's called the distressor breath, the belly breathing, the organizing breath. It's the one that is really, most similar to our respiration in general. It consists in a deep inhalation and a longer exhale. I'm gonna show you how. So inhale, pause, exhale. So usually I do it in 4 times inhale and 6 times exhale with 1 or 2 seconds pause in the middle, but you can do it as you like. As well for mouth or nose, inhale with the mouth, exhale with the mouth, inhale with the nose, whatever you prefer. In my opinion, I find the inhalation to be more effective through the nose. That is what the nose is made for. It filtrates the hair, it warms the hair up, it humidifies the hair, so I find it more effective, and also it canalizes the hair through a specific part of your body. And then exhaling with the mouth, it kind of just relaxes your jaw and your muscle, and it opens slightly your mouth. And opening is a word that we like to be associated with childbirth for obvious reasons. So I find it more effective, but again, up to you. You can do as you want. Just remember to relax the shoulder and keep your eyes closed or open as you like. Maybe have your partner close to you in order to keep pace. Once this breath is done cyclic with a rhythm, then it's fine. It doesn't matter how long you take. So one more time with me. And it really allows to provide you and your baby with a lot of oxygen, because you really take the most from the air you put in and out. This breath in particular is right for the first stage of labor, so the dilating phase, when you are hitting the active stage of labor. Really can be used at any point, but I find it particularly more effective while the contractions are still a bit spaced, 3-4 minutes apart, and they don't last more than 45 seconds. So give it a try and see how it goes. The second breath I'm gonna tell you about today, I call it the shh breath. Just because it's really kind of gives you the idea that you have to push the contraction away from you. And this breath is particularly right for the transition part of labor, when you're like 7, 8, 9 centimeters, when you are getting tired, when you think that you can't do it anymore, the contractions are getting closer, they're getting more intense, and you really don't know how to cope anymore. If you managed to do it pain-free up to this point, it's extremely important that you manage this breath now. You think you have the feeling that you're never gonna be able to see the end of the labor, but you're actually very, very close. So again, it consists into a quicker breath, a quicker inhalation and a quicker exhalation into different times. So again, inhale. Shh, shh. Shh, shh. It kind of brings your mind into a place of calm. If you're losing it, if the labor is becoming like very uncontrollable, if the contractions are hitting you badly and you don't know how to cope with them anymore, if you get your partner also to know this breath, he or she can bring you back to the contractions. Simply doing like shh, shh, it kind of will bring you back to that state of relaxation that you were trying to achieve before. You might find yourself being screaming and loud at this point, like, the contractions are so strong. You're trying to talk during the contraction. If sometimes I do it like shh to the moms, and immediately it calms them down and it brings them back down to a more relaxing state. You can also do an inhalation in 2 times. It's really up to you. You can do something like this, like just make sure that there is someone there with you to slow you down and to prevent you to hyperventilate. You want to do this breath usually with the eyes open, with a focusing a point, focusing on your partner. It really is a breath that requires concentration in order to get you through that last transition stage. The third breath I'm gonna tell you today is my favorite. It's called the Moo Breath. It's kind of like, it's a form of the J breath from the hypnobirthing. However, because I find the J breath to be a little bit hard to understand, then usually adding the moo sound with the breathing, it kind of gives you a better understanding of this breath. Long story short, I'll show you and then we can talk about it. So you saw my mouth was closed. Basically, this breath consists in inhaling deeply and then exhaling through your throat. Just like if you want to put your air back into your lungs, into your stomach, and then into your vagina through your baby. It's kind of an involuntary pushing that you do, and this is perfect if you're hitting the second stage of labor, meaning you're starting to have to push the baby, but maybe the baby is not in the optimal position, so you don't have to start to push yet. Maybe you're 9 centimeters, maybe you have an epidural and you don't feel the urge to push. This breath, if it's done properly, it does wonder, really. It kind of pushes involuntarily the baby down. In fact, it's also called like the breathe the baby down, and allows you to receive plenty of oxygen to you and to your baby, and to don't get tired from when you really have to give those last pushes in order to see your baby. If you are not able to exhale the air out into your throat, you can do something called similar to the sound that the cows do, in kind of this way. And you really feel like you have to push, kind of. Another great way to master this breath is actually to try to do it while you're sitting in the toilet trying to do a bowel motion. Instead of pushing the stools out, really try to breathe them out, and you'll see that will come actually automatic to you while you are doing that. You can also combine these breaths together, as I was saying. If you are doing the distress of breathing and then suddenly you feel like the urge to push, then you can just like use the J breath, the Moo Breath at the end, or you can really mix them and use them as you want once you are aware of what's happening to your body, and once you're aware on how much really these breaths can help you to cope with labor when everything is going through the roof and where it seems that there is no escape and that this labor is gonna last forever. Try, practice. Practice is the key to master these breaths. Don't leave it until the last moment. Practice, practice, practice. See you next video, mamas.